Are men or women more likely to become addicted? And which drugs are non binary individuals more likely to take? Today, a drug scientist, am going to teach you all about gender and addiction. Now, I'm warning you right now that this is a mess of a topic because we have barely been doing this research. Like, it wasn't until 1993 that we required NIH researchers, so people who are federally funded, to do research. We only started requiring them to have women in clinical trials, and again, 1993. And we only started requiring the preclinical side, so like people to start testing on rats, female as well as male rats, starting in 2016. It's only been a decade. This is because we've considered it kind of too confusing, too extreme, too difficult to actually start doing this type of research. Because supposedly women are too difficult to study because they have, like, hormones. Now, spoiler alert, men also have hormones, but women have more kind of fluctuating hormones. Like, our menstrual cycle drives changes in things like progesterone and estrogen, which can drive changes in things like drug use. So, like, the theory here is that women are too difficult to study because their hormones are too difficult, which, by the way, not even that difficult in rats. So if you want your weird fun fact of the day, rats' menstrual cycles are only about 4 days. So it's actually quite easy to look at the differences in menstrual cycles. Bet you didn't expect to be learning that information today, did you? So the idea that the hormonal fluctuating can change drug abuse actually is pretty valid, and I can go on an entire topic about that if you want me to. We do see that things like progesterone are linked to a decrease in drug addiction, and estrogen are linked to an increase in things like drug use, but it is way more complicated than that. And it turns out that the complication is very interesting when you think about, like, could we use progesterone as a treatment for addiction? So we've only required this type of research for like 40 years, and we don't require it for non-binary or transgender individuals, so there's even less on that. And it's actually even more difficult to do when your government tends to, I don't know, completely dismiss the science, suggesting that there are more than two genders. And that's not counting actively working against it by putting in NIH guidelines that say that focusing on gender ideology is extremism. But anyways, here's what we know about the topic. So in general, we see that males are more likely to actually experiment with drugs. And for a while, they're more likely to use basically all drugs of all sorts. And then gender equality. And so now women and men are basically equal in terms of their drug use. Now, there are obviously cultural differences here. So in some cultures, it's much more acceptable for men to drink or for men to smoke. And so you'll see that there are more gender differences in cultures that have very specific kind of social aspects of it. But in general, we're kind of getting close to males and females using drugs at a relatively equal level. But there are some important differences when it comes to addiction. So what we see is that women typically have more barriers to treatment and have more stigma against things like drug use, which makes it more difficult for them to quit. And we actually see that women typically have greater withdrawal symptoms from drugs. Now, men have greater withdrawal symptoms from alcohol, and women are actually more likely to move to kind of compulsive drug taking. So that they'll actually just kind of start using, and then it becomes a habit and they need to take it. Like, they crave it. And when you stress males, it actually gets them to the female levels. But in general, men are less likely to kind of have that compulsive behavior. And women are more likely to relapse, and they're more sensitive to kind of cues. So, like, the environmental cues that become associated with things like smoking. So if you go into your car and you typically have a cigarette there, women are more sensitive to those kind of environmental cues as well as stress, and the likelihood of it actually causing a relapse. Now, most of these differences are seen both in the preclinical models, so like basically having rats take drugs, as well as the human models. So they kind of have comparable findings, and so there's a lot of preclinical research out there on drug addiction. But when we study it in preclinical models, we are only looking at males versus females, which makes me curious about, like, how many intersex rats are actually out there that we have not known about. So preclinical researchers, people who are doing like rodent research, typically only looking at external genitalia, and we see that a lot of animals have external genitalia that does not match their internal genitalia. So for example, I have an intersex cat. She is externally female, and internally, we don't know. So we probably are inappropriately putting them into the binary male and female categories too. Now, when it comes to non-binary or transgender individuals, all of this research has been done kind of relatively recently, and all of it in humans. We see some interesting differences between groups. So, for example, transgender individuals are more likely to report binge drinking, like 3 to 4 times more likely to report binge drinking. Now, there's a bit of controversy if they're more likely to also have alcohol use disorder. This is kind of up for debate. But in general, we do see that transgender women are more likely to have kind of negative consequences from alcohol use. So they are more likely to black out, for example. Now, non binary individuals are more at risk for things like alcohol use disorder, but don't seem to be more at risk for things like vaping. But transgender individuals are far more at risk for things like vaping. Like, again, we're talking about like 3 to 4 times increased risk here. Now, weed is a different story. So, what we see is that non binary individuals are far more likely to meet the criteria for addiction for weed. And they're far more likely than even transgender individuals who are higher than cisgender people. Then we have the final category of illicit drug use because you look at alcohol and then you look at weed and then you look at nicotine and then you look at literally everything else grouped into a category as though things like hallucinogens and blow are very similar to one another. We see that illicit drug use is much higher, specifically in transgender women, although transgender individuals seem to have an increased risk. But there's very little out there on transgender men and quite a bit out there on transgender women. I have absolutely no clue why that is. And there's a single study on non binary individuals and illicit drug use, suggesting that they might actually be less likely to use things like blow. But again, a single study. Now, we have all sorts of problems here. So we have the social aspects of gender. We have the ideas that maybe certain groups, especially like transgender individuals, might be more at risk for things that make them more vulnerable to drug addiction. So having a mental illness, for example, going through kind of traumatic incidents, being more likely to experience discrimination. Like those things make somebody more likely to use drugs. And those things are more common specifically in transgender individuals. So there's all sorts of like societal, environmental, all different aspects going on here, but that's kind of the general information on what's out there. So men may be more likely to try, women more likely to experience kind of the negative effects of things like trying to quit. Transgender and non-binary individuals seemingly a little bit more at risk, but it seems to depend on the drug as well. That's a quick TLDR, but honestly, we need to study this far more. And I'm not just saying that because I'm a sex difference researcher myself.